Discogenic low back pain refers to pain that comes specifically from the disc, meaning the intervertebral disc. It's actually a pretty rare occurrence. A lot of people have problems on their MRIs, and it's important to first understand that just because you have something wrong in your MRI does not mean that it's a source of pain. I've seen plenty of MRIs of just really severe degenerative disease in their backs, really horrible looking spines, but the patients are in no pain whatsoever. And I've seen really clean MRIs with people being in significant pain. And it's not because one person's tougher than another, it's because MRIs don't diagnose pain. They can't. They diagnose what your back looks like, but identifying a pain generator is very different. But beside the point, I wanted to talk about discogenic back pain or pain from discs. So the intervertebral disc can be a source of pain for people, but it's extremely rare. Most of the time, your back pain is not from your disc. It's from your joints, like arthritis. It's from weak muscles. It can be from a pinched nerve. It can be from cysts. It can be from lots of other things, but typically not your disc. There is nerve innervation of the disc, but unless you've eliminated all of those other options, it's probably not your disc. What about disc pain? Can it occur? And the answer is yes. I only diagnose it maybe less than 5% of people. And generally, honestly, it's in the athletic population. It's people who are very healthy, who are already very strong in their core, who have very minimal arthritis or have already been diagnosed and treated for their arthritic pain. And the only thing left is the disc to treat. And so if it is the disc pain is axial back pain, meaning right in the middle of the back. It's stabbing in nature, like someone stabbing you with a knife. And it's really bad with any sort of compression, meaning bouncing up and down or jarring motions, as opposed to range of motion. So if the pain is worse with moving forward, moving backward, that's typically not disc. But if the pain is bad with like bouncing on a dirt road or lifting heavy objects, that can be disc pain. There isn't a whole lot of treatment for discogenic back pain, unfortunately, but in the future, and hopefully near future, we'll have some really good options with biologic treatments, meaning PRP or stem cell therapy. That's still experimental, but it's coming down the road. There are people that are doing it now. We are doing PRP now, and we will eventually be starting doing some stem cell therapy as well to hopefully regrow or regenerate the disc. But for now, it's core strengthening, it's making sure you have no muscle imbalances, and really taking care of the whole patient from top to bottom, not just the disc itself. And again, in the future, maybe we can inject something directly into the disc to help regrow or regenerate the disc.